Turn to M3 and Karen B for this week's episode of Comply on the Fly. You'll get quick and timely answers to the most common compliance questions so you and your business can keep moving ahead. Please note this podcast and the contents herein do not constitute legal advice. Please seek the advice of counsel for any benefit compliance related implementation guidance or strategy.
Hello, everyone. I'm Karen B. And the Comply on the Fly question of the week is, can a mental impairment or condition qualify for FMLA? The simple answer is yes, but let's go through the analysis. First, does the employee need time off from work due to this condition? If so, then there must be some sort of leave or leave policy that would need to apply for the employee to be absent from work. If you are an employer that is subject to FMLA, and generally that means that you have 50 or more employees, then we next would look at the FMLA requirements. Federal FMLA does provide 12 weeks of unpaid time off for an employee's own serious health condition. So the next question would be whether the mental condition or impairment qualifies under that definition. So what is a serious health condition under federal FMLA? A serious health condition means an illness, injury, impairment, or physical or mental condition that involves inpatient care or continuing treatment by a healthcare provider for a condition that prevents the employee from performing their job or prevents the family member from participating in school or other daily activities. So what we're really looking at here is the fact that the definition of serious health condition does include a mental condition. However, it has to have inpatient care or continuing treatment. More specifically, what is that continuing treatment, or what is the treatment that is required? So federal law says that in order for it to be a serious health condition, any of the following should apply. Either it's a condition requiring inpatient care in a hospital or residential care facility, or it's a condition lasting 3 or more consecutive calendar days with either 2 or more treatments under the supervision of a healthcare provider, or 1 treatment by a healthcare provider with a continuing regimen of treatment. Also, it can be a chronic health condition that continues over an extended period of time, requires periodic visits to a healthcare provider, and may involve occasional episodes of incapacity with or without a provider visit, or a permanent or long-term condition for which treatment may not be effective, but which, again, is under the supervision, not necessarily active treatment, though, of a healthcare provider. Also, you should check applicable state law for what it may or may not say about mental conditions. For instance, in the state of Wisconsin, the definition of a serious health condition is a disabling physical or mental illness, injury, impairment, or condition involving, again, inpatient care, nursing home or hospice, or outpatient care that requires continuing treatment or supervision by a healthcare provider. This particular definition under state law does not include any examples. So the medical certification becomes very important in these certain situations because it will be key for how you apply this definition to the details, hopefully, provided by the healthcare professional filling out that medical certification. And that is our Comply on the Fly question of the week. Thanks for tuning in.
What's on your mind? If you have a pressing compliance question, send it to askkarenb@m3ins.com. We'll do our best to cover it in an upcoming episode of Comply on the Fly. Make sure to tune in next week and encourage others to join us.